what tends to happen is, when we're exercising, of course, we have a sympathetic nervous system response, and it's necessary in exercise. It's what, kind of diverts blood flow, away from our internal organs out to our skin to help us cool. It gets our heart rate up. It gets blood returning to our heart more quickly.
Welcome to the Holley Field Nutrition Podcast. I'm your host, Holly Samuel, and I'm a registered dietitian, board certified in sports nutrition. I'm a certified personal trainer, and I have my master's in health education focusing in eating disorders. And on the Holley Field Nutrition Podcast, we provide you with the nutrition knowledge for all things running, endurance sports, preventing injury, burnout, and more. I'll interview everyday runners and athletes making it happen just like you, along with various professionals and experts in the nutrition space. We'll chat about experiences as a runner, how nutrition and fueling impacts training, performance, and your overall health, and of course, adjustments you can make to be the best runner and healthiest version of yourself that you can be. Let's get into the episode. Hello, Dr. Bideaux, Abby, as from here on out. It's so nice to welcome you to the show today. How are you doing?
I'm doing great. I'm so excited to be here. Thank you for having me, Holly.
Well, thank you for telling me that I should have you on the show. I probably covered this in the intro, but I mean, it was great. I've been trying to cover this topic for a really long time and have failed to do so, and have tried to cover it from like my personal trainer, like run coach, dietitian perspective, but super helpful to bring in the expertise of someone who is a physician and trying to specialize in sports medicine down the road. So I just really appreciate you like volunteering. This is great. So tell everyone who you are, where you're located, and what you do.
Yeah, so my name's Abby Bideaux. I'm currently a third year resident in a specialty called physical medicine and rehabilitation at the University of Virginia in Charlottesville. So I'm a doctor in physical medicine and rehab, which pretty much means we work a lot in musculoskeletal and neurologic conditions. And one of the focuses of my program, and a big reason why I wanted to go to University of Virginia, is because we have our own runners clinic, where we exclusively see runners and some other athletes, of course, really helping them stay healthy. And it's a lot of recreational runners in addition to some UVA collegiate runners as well. And being a runner myself, I ran all through high school, and I ran also at Cornell University, D1 cross country and track. So this is just a passion for me, in helping runners stay as healthy and competitive as they can.
I love that. And like to kind of marry those two, like medicine and also just your own experience, I think is so valuable. It's always nice when you have a doctor or a physical therapist or a dietitian or someone on your team who gets it, who is a runner and or has been like in that situation before. Because you can just speak so much more to like the little nuances of training and not just be like, why do you want to keep running when you're sick? Like a lot of probably non-athletic physicians might say, because there is quite a bit of nuance to this topic. So I really appreciate that, and very cool that you get to work with runners like in such a like close quarters at the in Virginia. Yeah, so I mean, tell us a little bit about like, in terms of diving into this topic, we want to cover essentially like why runners may be more prone to getting sick sometimes, what can happen with the immune system, and then definitely bridge the gap between, okay, let's prevent that from happening, but if it does happen, when it does happen, if you're getting sick, how to kind of approach training when that happens. Because there's times to keep going and there's times to stop and rest and approach it a little bit more cautiously. So to kind of start off, why do runners get sick, and what are they more prone to getting sick with?
Yeah, absolutely. That's a really important question. And I think one that, it has been a question for a long time. So there was actually a study in 1901, believe it or not, that looked at four Boston Marathon runners. And I know you just ran the Boston Marathon, so congratulations on
Thank you.
great race there too.
Got my unicorn right here.
Oh, awesome. I love it. So yeah, it was a case study. It was just four runners, but they took blood samples before and after the Boston Marathon and they looked at white blood cell counts. All four runners had normal levels before the race. They didn't have any kind of, pre-existing medical conditions. And then after the race, they took these samples within 5 minutes and they found elevated white blood cell counts from 14,000 to 22,000. And if you're in medicine, you know that a normal range is 4 to 11,000. So they were all elevated in kind of ranges that are consistent with an infection. So, why does this happen? And um, intense and prolonged exercise kind of leads to an immune response that's different than moderate and low intensity exercise. And there's a lot of reasons for this. The immune system, of course, is very complex. But what tends to happen is, when we're exercising, of course, we have a sympathetic nervous system response, and it's necessary in exercise. It's what, kind of diverts blood flow, away from our internal organs out to our skin to help us cool. It gets our heart rate up. It gets blood returning to our heart more quickly. So it's a necessary response. However, the hormones that allow for the sympathetic response, cortisol, epinephrine, norepinephrine, or kind of sympathetic adrenaline hormones, they lead to an inflammatory response. And a prolonged inflammatory response can put us at an increased risk of infection. Typically within like a 3 to 72 hour period, kind of depending on the intensity of the exercise. And I think another thing that's important to think about is kind of what runners consider moderate versus
Yes.
intense exercise. So the AMSSM, so it's the American Medical Society for Sports Medicine. When you look at their guidelines, kind of with like infection risk and exercise, they're saying moderate intensity exercise in small doses is good for the immune system, but they're defining moderate intensity exercise as 40 to 60% of your max heart rate. So for a 20-year-old, if you're using the 220 minus your age, a 20-year-old max heart rate is, let's say, 200, just to make the math easy. So if you go in the middle of that range, 50% of a 200 max heart rate, that's exercising at 100 beats per minute, right? And
That's walking.
that's exactly. So they're considering moderate intensity exercise more as walking, whereas they're considering intense exercise a 70 to 80% of a max heart rate, which again, let's say 75% of 200 is 150 beats per minute. So that's more of what, your normal aerobic run is going to be. And if you're marathon training, you're easily doing, quote, intense exercise every single day of the week. So in,
For long durations too,
right.
like, again, as defined by, like, what is recommended to society. I mean, I always try to clarify that on the pod too, because when you hear nutrition or health recommendations, it's like we're talking to the sedentary population, we're trying to get them to exercise like 150 minutes a week, and it's like low to moderate intensity. It's like not running. Um, but everyone listening to this podcast probably is doing so much more than that, even if you don't consider it hard. It is scientifically, technically, yeah, at that higher intensity. So I appreciate you clarifying that.
Yeah, exactly. So a quote easy run is actually, it's considered in that intense category from these kind of how these studies are being carried out on the immune system. So I think it's just good to keep that in perspective, because I think that, our audience is, not the typical, you know, person in terms of what they're doing for exercise.
Yeah, and I think it's interesting too, the Boston Marathon study that in 1901, I mean, so cool. I love that, pretty much every year at that marathon that you can participate in research, which is really cool because they just take advantage of that super large like sample size of it's a broad, population, but it is a little bit more specific than just taking a random 30,000, sample size. It's everyone running the same marathon, but it's really cool that they do that. And I think it's like a unique experience too with marathoning because you talk about things like a marathon world major or just traveling to races, which is really common right now, especially. And yeah, we've got these super elevated like white blood cell counts as soon as we finish the race because our immune system is just responding to the intense amount of exercise we just did, like you said. And then it's like we interact with like a bunch of people. We get on a plane, like we're in public places where there's germs being passed around. So I know from my perspective, when I go through, like the big race seasons with people, it's like everyone gets sick like after these big races because it's just kind of like the perfect storm. Um I mean, people care at that point, but typically not as much because the training's over. But sometimes I find things can really linger just because yeah, their immune system's like so shot after a race like that. Um I mean, in terms of like kind of talking about this a little bit more, I know there's research on like upper respiratory infections, like specifically. What do you tend to find with runners? Like, what tends to be the biggest instigators, especially when people are getting sick a lot? Like, why does that tend to happen? What are some potential root causes of that, where we could look into supporting their immune system to keep them healthy despite all this exercise that they're doing?
Yeah, absolutely. So yeah, upper respiratory infections. So rhinovirus, like your common cold, sinus infections, COVID-19, the flu, all of those things runners are particularly at increased risk for. I think there's a lot of different reasons for that. Of course, everything we just talked about with kind of the depression in the immune system function. When you're running, especially if you're running with other people, you're
Mhm.
increasing your oxygen uptake. So, you're already kind of breathing in more of those particles. Um, I think, I mean, there have been multiple studies. I know there was actually like a recent meta analysis on this as well that after a marathon, runners are, I think, almost 20% at increased risk of getting an upper respiratory tract infection.
Mhm.
I think another thing, like you were saying, in addition to just being around crowds of people, like especially around races and training, like our sleep usually isn't perfect. You're getting up really early to get to these race starts. And so there's just a lot of different variables that are contributing to, um, you know, our immune system just not being where it normally is.
I'm curious too, like just depending on the population you've gotten to work with thus far. I guess how I want to phrase the question is like, do you have even a range that you would consider like a normal frequency of getting sick? Because I know like some of my runners, they do, myself included, like they do fine. They're never sick. And then they have kids, their kids start going to daycare or school, or maybe they start working in like a hospital setting or a school environment where I like to call it, it's like the germ jungle where there's just a lot more going on. Um, you know, from a like epidemiology perspective. Um, like, and they start getting sick like every single week and they just feel like they just keep getting kicked while they're down. And it's really hard to complete their training. I guess my question is, yeah, like, is there a certain pattern that's a sign that something's missing from an immune support perspective, whether it's not sleeping enough, poor nutrition, doing too much training, poor recovery, or even all of the above?
Yeah, I think kind of what you're alluding to with if it's recurrent and if you feel like you're not even fully recovering from, the first infection before you get another one and just kind of on infections on top of each other, that's when I would definitely recommend that you go see, your primary care provider, especially like a lot of these most commonly an upper respiratory infection is caused by a virus, but sometimes if it lingers, it's lasting beyond like 2 weeks, you're getting like a superimposed sinus infection that's really only going to be taken care of by an antibiotic. So I think that's really important to remember, if it doesn't resolve in like it does take like 10 to 14 days typically, but if it's not resolving by then, that's definitely when it's time to, make an appointment and go see a provider. But I think just in terms of, you know, if you're getting more than kind of like 2 or 3 upper respiratory infections a year, that's a red flag,
Okay.
and something needs to change.
Yeah, I appreciate that. Like more specific answer too, because I think, yeah, people can wrap their heads around it, especially if it is really lingering that long. And it's like, okay, this is 2 or 3 bouts of being sick for several weeks per year. Yeah, when I am just in my neck of the woods, in my scope, when I tend to see that, there is usually also like some nutrient deficiencies, and maybe we're not eating enough, and our recovery is not great, and we're also getting injured. And it's not just that we're getting sick. A lot of the times there can be like these other things going on too that is just another red flag to make sure things are in check. Um, so kind of in the vein of specific, like returning to training and when to keep training, when to stop. Um, I mean, it definitely sounds like exercise is good for the immune system. And when it's a lot of exercise, which pretty much everyone listening to this podcast falls under, it's a very fine line. It's a little stressful for the immune system. And there's a lot of nuance to that. So if someone is finding that they're sick, um, let's talk about how to go from there. So most of the people that I coach, and again, a lot of the people probably listening to this show are pretty stubborn and just like want to keep going. I've not advised this, but I've had people run through the flu, run if they have fevers, run no matter how they feel. And I've seen that go really poorly. So I think there's a lot of, different levels of stubbornness that can come with this, because things like pain and how good or bad you feel are super subjective. So just to try to make this a little bit more objective, if someone has a head cold and is like starting to feel a little congested, maybe a little tired, like just a little under the weather, in that scenario, to kind of start there, and then we can get more specific to other scenarios, what would you typically recommend they think about?
Yeah, so I think, first and foremost, if you feel something coming on like that, my recommendation would be, kind of take a day or two off and like see if it you can kind of just nip it in the bud, maybe skip your run, get like an extra hour of sleep or something. That would be my first recommendation. But, if that phase has passed, you have a little head cold upper respiratory infection. Um, and you're kind of wondering, can I train through this, or kind of how do I come back after training through, or after having kind of a mild cold. My recommendations are actually kind of similar to those I would give somebody who's trying to come back from an injury. So they kind of follow the same principles. So the first one is, basically that mild symptoms are okay to train through. So in a pain scale world, we would say 0 to 3 out of 10 pain. So I guess I would consider mild, upper respiratory symptoms. Like if you're having, a little bit of congestion or runny nose, a cough, that's okay to run through, but with the caveat that it's not getting worse while you're doing the activity. So, if you're running on the treadmill and all of a sudden, you're starting to just, not coughing nonstop or feel like you can't breathe, like that's not okay to push through. But I'm not saying you have to be completely symptom free in order to run, because that's not realistic. And I know runners aren't going to follow that in the first place. Plus, I don't want to say you have to be sedentary, but just keeping in mind to keep the symptoms mild. The second is that you're not paying for it. So you finish a run and you don't feel worse than when you started the run, and like 24 hours later you're not feeling any worse than you did when you started that activity. So basically it's not flaring up your symptoms, is the second thing. And then the third thing is, and this is one of the things I recommend the most when someone's sick, is symptom free cross training. So, you know, maybe you can run for 10 minutes and, just kind of see how your body feels. And then go on the bike for 30 minutes because that cross training that, it's still getting your aerobic system going, but it's not the same as running. Like if you're seated on the bike, your body just doesn't have to work as hard to maintain your blood pressure. You can kind of just, I find, like control your effort a little bit more.
Yeah.
So I think supplementing with that cross training, not only to kind of replace your activity, but kind of just to help you kind of test your limits and maybe get a little bit more volume than you could with the amount you're able to run currently.
Yeah, because like you said, I think on the bike, it's harder to get your heart rate up into like those intense zones, so you can keep it a bit more honest. Because I know runners are good at just like being delusional and being like that my symptoms aren't getting worse, even though they definitely are getting worse. But then all of a sudden you're 30 minutes away from your house. So you're like, well, I got to get back somehow. So, you end up overdoing it. So I think, yeah, the cross training tip is a good one because you can just kind of test it in one place and bail if you need to.
Right.
um, with, um, with, with this, like, I've often heard I don't think it's necessarily bad advice, but you can tell me. I've often heard people throw around like, "Oh, if your symptoms are from the neck up, it's okay to like keep going and exercise. But if you have like body aches, a fever, like exhaustion, and you have these more like full body symptoms below the neck, you should probably rest or rethink what you're doing." I don't know if there's any like scientific fact to that. But it kind of sounds like it's a little bit consistent with the almost the pain scale symptoms that you're talking about, but I don't know if you've heard that before.
I have heard that, and I never, we were never taught any kind of like scientific basis to that in medical school, but I think it does make sense. Like
Yeah.
if you're having like, like I guess like difficulty breathing or like kind of that real deep, more like cough and bronchitis versus kind of just like, some sinus pressure. I would feel more comfortable with that
Mhm.
person with sinus pressure running. And yeah, if you're having like a fever and body aches, like I definitely wouldn't recommend training through any kind of fever. I think that's the sign of, your body's just not ready at that point. So that's one symptom I would say you need to wait until the fever resolves to start training again.
Yeah. It also feels awful.
I think another guideline that I would have people use is like if they're used to training by heart rate at all, I think that can be a great way to really kind of objectively track your symptoms. So usually like when people are sick, I say, oh, kind of it's okay to let your heart rate get up maybe like 5 to 10 beats per minute, like above your normal, because your body just, if you've had to take a few days off and, things just aren't really quite the same, that might be about the same effort wise. But beyond those 5 to 10 beats per minute, I don't really want you pushing past that. And I
Yeah.
prefer if you keep it in like a more aerobic zone. You really shouldn't be pushing into like any kind of tempo or more interval heart rate zones.
Yeah, that's good like runner lingo too. You can be maybe thinking about, oh, I was supposed to do a speed workout today, but maybe I'll make it an easy run or even just a walk. So I get to go do it, but I'm adjusting my training schedule accordingly. Yeah, no, I think that's great. I mean, to get even more specific, just because I know people have asked me this over the years with the global pandemic that we had, with things like I took a COVID test and it was positive, or I took a flu test and it was positive. Um, I know there can be a really wide variety of how people experience those two things. I think the flu is probably a little bit more consistently severe than COVID seems to be like you can have no symptoms or you can be in the hospital. If you know you're positive for something, do you still kind of go off of everything you said so far symptom wise, or do you recommend something different for those specific ones since people
Yeah,
have tests for them?
yeah, that's a really good question. I think at least in terms of COVID, barring like any underlying like cardiac or respiratory history, medical history, I would say I would still just go by symptoms. Like you said, it affects people so differently in terms of how it manifests. So
Yeah.
if some people, they might not even know they have it.
That
So
was me.
yeah.
Felt very lucky.
Whereas when I had it, I was like laid up in bed for 3 weeks. So
That's how my husband
um,
was. I felt bad.
yeah.
I was like, "Oh,
So
no."
um, yeah, at that point, I would say again, it's still really just symptom based, and I think as a medical community, we're actually moving more and more towards like symptom directed kind of return to sport.
Mm,
Like the AMSSM, they just came out with a new position statement on mono or
mm,
mononucleosis. And that used to be kind of a strict, I believe it was like 3 weeks like off of sport, kind of no matter what. And now
mm,
they've kind of updated the guidelines to being like all symptom based. So
cool. Yeah, that makes sense. I know the first couple of guidelines I read from COVID were kind of like that. They were like the first week, it was like 25% after being fever or symptom free for XYZ days and then scale up from there. But just with how it's transformed, I imagine the guidelines also transform.
right. And I
Um,
think with COVID in particular, there was initial concern for myocarditis risk.
yeah.
But that has since the research I've read hasn't really supported that there is necessarily an increased risk of myocarditis around the time of a COVID infection. So I think again, like it can be mostly symptom based. As
Yeah.
long as, of course, you're not gonna go, run at a crowded gym or track or something. Don't
Yeah, yeah.
don't do that if
Smart.
you had a positive test. But
Yeah, just go outside in some secluded area where you're not breathing on anyone. Bring a phone with you just in case. Would you say the same thing is true for the flu, or is that any different?
so with the flu, I think the main thing I'd be concerned about is if the person's having like any like GI losses like vomiting or diarrhea. But other than that, I think like if it's more of the upper respiratory symptoms, then still symptom guided, no real specific time frame.
Okay. Yeah, that makes sense. I wanted to talk about that too, like in the return process. Other things to think about. I know if there is GI losses, dehydration, and other complications from severe dehydration and electrolyte imbalances and stuff can really be of concern with like norovirus or even food poisoning or those types of things. Do you have any like recommendations for that, or even like if you've been throwing up for this amount of time, you should definitely go like get fluids? Do you have to do blood work first? Like how does that look for those types of fun bugs?
Yeah, so I think the main thing that I'd recommend, like for at least for runners who've been having any significant vomiting or GI losses, I mean, for everyone really, but particularly runners, like are going to be at risk of higher risk of any electrolyte imbalances. So, hyponatremia, hypokalemia, so low sodium, low potassium, even chloride is lost when we vomit. So all of those things really important to replenish. And I think people have this idea that when they're sick, like, oh, I don't need to eat as much, I don't need to drink as much. And it's not true because your body is actually in a more metabolically active state when you're sick, making antibodies, making white blood cells, fighting an infection. So you're burning more calories at rest than you typically would, and you do need to replace all those calories and electrolytes. So one important recommendation I have in terms of rehydration would be to make sure that you're using an electrolyte drink that also has sugar, because sugar actually enhances sodium uptake. There's um, a lot of sodium glucose co-transporters. As you know, as a dietitian, I know you know way more about than I do.
Sugar.
Yeah. But
Yeah.
those molecules are taken up together. I think it's like what, one molecule of glucose and two molecules of sodium or something from the small intestine to be brought into the bloodstream. So
Yes.
making sure you don't get the sugar-free Gatorade, like, this is the time where you need the full sugar. You need to maximize that sodium uptake as much as you can. So
Yeah.
I think that's something that people don't realize.
Especially if you're struggling to eat too. It's like extra calories can just come from the liquids. And I think I'm so glad you touched on that. Because I think too, with my clients, they'll tell me, "Oh, I was sick or this was happening the last week or since we last met, but, I'm wanting to get back into things now or I'm feeling better." And I always ask, I'm like, "Well, how is your appetite and how is it now?" And a lot of the times they're like, "My appetite was awful and I didn't eat anything but toast and Gatorade for like a week straight." Um, and like you said, if we were perfectly healthy, nothing going on, and we decided just to have toast and Gatorade for a week straight, we would not feel great, after that week. But we're adding on top of that the increased metabolic state of being sick. And we're adding on top of that for some people that they did try to exercise through it. So that's kind of like an extra tax on the body. So we're not just recovering from being sick, we're also recovering from probably under fueling a little bit. For that week, maybe being a little dehydrated, and to expect to just flip a switch and go back to your regular training and feel fine is typically not the reality that a lot of people I think experience. So, yeah, I just love that you emphasized how important nutrition can be in recovering. And just to try and like, yeah, almost force feed yourself a little bit when you're sick and get down what sounds good and really focus on, yeah, the carbs and the sodium and the fluid together to help with the actual uptake of that. In terms of like other things nutritionally, supplemental, micronutrients, what else? Because I know there's a bazillion products on the market that are, kind of marketed towards improving immunity and boosting your immune system, to put that in air quotes. So, what are your thoughts on that in terms of the research?
Yeah, so I mean, there are so many immune supplement products from, vitamin C and zinc to kind of, these antioxidants. And interestingly, like the research shows that actually, like the best thing for your immune function is actually carbohydrates and calorie intake. So
Boom.
before we even talk about any supplement, like if you're not doing those two things, then you know, it's really, I mean, I think at least a lot of the research that I've seen on like particularly like vitamin C and zinc is that, and you might know more about this than me. It's more like like they're good if you're taking them preventatively, like they can help you avoid getting sick. But once you are sick, those things I've had like coaches actually who like swear by like Holdies, which is like
Mm.
vitamin C and zinc, but like I never noticed that it like shortened the duration of my cold or anything. So I don't really think those things are
I like to think that it did, but, like, it
bad.
probably didn't. Yeah. Yeah. No, it's true. I think that's spot on, especially for vitamin C, zinc, and even vitamin D too a little bit, is if you're taking them, preventatively, like, you're going to get on a plane to go to a race and you would like to protect your immune system if you can, and maybe you're taking them for a week or 2 leading up to that. It can help a little bit preventatively, but not as much as eating enough carbohydrates and eating enough in general and getting sleep would. So they could be good tools in that regard, but I agree. Once you're sick, it kind of seems like the research is like, well, it probably doesn't hurt, but it probably doesn't really help that much, which is when most people end up reaching for them.
Right. So I think like exactly like what you normally preach in your podcast, like you have to focus on like macronutrients and calories first. And like this is actually a really important part of like preventing illness as well, because when we're in like a hypoglycemic low glucose state, more cortisol is going to be released to stimulate gluconeogenesis, the process where the liver is breaking down stored carbohydrate to produce glucose. To get those levels back up in the bloodstream. And that a lot of that is what's contributing to the weakened immune system after endurance exercise. And so I think it's the Journal of Exercise Immunology. Like they have a lot of research showing that getting enough carbs during exercise is actually more important for immune function than even like post workout carbohydrate replacement. So their recommendation is 60 grams of carbs per hour of endurance exercise. And that kind of blunts that cortisol response because you're keeping those blood glucose levels at a nice maintenance level while you're working out and not letting it tank and then trying to bring them back up after the fact.
I love that, and that's one reason too why I I and all of my sports dietitian colleagues are so adamant about, like, fueling during, and people will often ask, "Well, if I fueled well during, like, do I need to still eat before, or do I need to still eat after?" And yes, you do, and the fueling during isn't just about performance in the moment, it does also help with recovery for that reason because you didn't insult your body as much essentially while you were out there, which is so important because if we're following a training schedule where there's that longer effort on the calendar, once or twice a week, every single week, that can really add up to make you feel a bit run down, later in your training cycle, if you're not fueling adequately, especially. So yeah, we always love some extra love for carbohydrates on the pod. Um, kind of talking about um nutrition to continue. I know you had mentioned creatine, glutamine, and quercetin as well. I didn't know if you wanted to speak on those, since I've been asked about these as well in the past.
Yeah, so there has been some research showing that creatine can kind of blunt like the muscle inflammation response after exercise, so potentially kind of decreasing that muscle level inflammation. There are like so many benefits of creatine, so that is one that I would say like if you want to add that in on a regular basis and you're already doing crossing your T's, dotting your I's with all the other things that you need to be doing in terms of macronutrients. I think that's something that could be beneficial. Um, Quercetin is kind of it's called a flavonoid. So it has kind of some anti inflammatory properties. It's like naturally found in tea, some different vegetables, citrus fruits. Um, that has been shown to potentially decrease the inflammatory response after exercise. I think with that one, there's kind of it's a little bit like we don't really know the mechanism, but it has some research has shown it decreases the incidence of upper respiratory infections in athletes after particularly intense exercise. So I think that's another one to kind of continue to, look at the research on and see if we get some more evidence behind that. Um, Glutamine, so that's like our most abundant amino acid in the body. Um, and there has been some studies showing that glutamine levels decrease with prolonged exercise, and glutamine is actually a really important fuel for our immune cells. So I was able to find one study that showed decreased incidence of upper respiratory infections with glutamine supplementation, but again, I think that's another one where we just need more research there.
Yeah, I like to pay attention to things like glutamine and also like antibodies like that. Colostrum's really trendy right now, not even specifically from colostrum, but there are some, like, antibodies that are immunoglobulins, rather, that are found in colostrum that also there are some studies on to show they can reduce upper respiratory incidents and also intestinal permeability, which I find glutamine tends to fall under too, because like you said, it's the most abundant amino acid in the body, and I find when people are kind of in this like rundown state where we're talking more about they're getting sick a lot, there's like chronic, immune stuff going on where they're just a bit run down. They also tend to eventually develop recurrent like GI issues, which stinks because then we're not absorbing everything that can help us not be so run down. And I feel that like one of the reasons that can happen is just because when we're exercising so much, blood's being perfused away from the gut, and kind of continues to be so for periods of time after the exercise is over. And then our gut tissues also aren't getting that good blood flow. And glutamine can be really lacking there. And I do find if people can keep up their glutamine intake, especially through like whole food sources, proteins, that type of thing, and just take off seasons too and not always be training all the time, it can really help calm down some of those GI issues and then also help with like their immune function moving forward too. So yeah, I just thought it was cool that you brought that one up because I like to look at that a lot in practice. Plant-based athletes too, especially if they're not getting a lot of like animal sources of protein, which is where some of these things are found. I also wanted to talk about everything you've said so far is fabulous, especially like just being really candid about being honest about where you're at with your symptoms and returning to exercise. I think one of the big barriers I find to runners actually successfully implementing this is like the panic that can come with, but I have a race on the calendar and my training's all going to go, downhill if I skip even a couple of days. Or maybe they're getting sick the week of the race and they're really stressed that the race is on the calendar. What advice, I guess, do you have for people with those thoughts? Because I know if nothing was on the calendar, I think people would be more apt to take this advice of resting, or being a little bit more cautious. But I know a lot of the times there can be that timeline pressure.
Yeah. Well, first of all, like I totally understand that feeling. Like
Yep.
um
Same.
I did a marathon almost a year ago now, and it was about 3 weeks before. It was right before I was supposed to do my last long run. I got an upper respiratory infection, and I'm sure it had a lot to do with, I was traveling. I was, as a resident, we're on call all the time. So sleep deprivation is huge. But so I totally know that feeling. And I understand, I'm talking about myself here. Runners are most often these type A people, and we want to stick to the schedule and we want to check all the boxes. And it's a lot easier said than done. But when you're sick and you're trying to, stick to that rigid schedule, or, you're trying to pick right back up where you left off on your training, or even, I've seen people try to like make up workouts, which I really never recommend. I know the feeling of just wanting to complete the plan perfectly, but you're really doing yourself a disservice. If when you're sick, you're kind of put like you're already kind of in a hole. Your nutrition's not where it should be. Your body is fighting something. Um, you're just making that worse by trying to push through too much. Like we were saying before, pushing through, a mild level of symptoms can be okay. But I would just say, like you were saying, you just have to be as honest with yourself as you can, and just remember that if you push through this, you're gonna be just further setting yourself back.
It's so hard.
It is. It is.
I got a sinus infection training for Boston too. I knew visiting friends with 4 school-aged children, we were not going to return unscathed, but I was hoping that it wouldn't be all of us getting sick for 2.5 weeks, like it was. And yeah, it's hard. I mean, it became less hard for me because I was just like, I felt awful. So I was like, I'm not definitely not gonna try to run because I can't imagine trying to run. But yeah, you definitely have those feelings of panic and I agree with you. I mean, a couple days off, even a week off, even 2 weeks off, if it's really bad that you're taking 2 weeks totally off, you probably want to be cautious about returning and maybe revisit what's realistic for your timeline. But those things don't really affect your fitness that much. In this grand scheme of things, it really is a blip on the radar. I think I've gotten sick every Boston Marathon training cycle the past 3 times in a row I've done it, and I've still run my top 3 fastest marathons at Boston, even though I had to miss workouts and miss some mileage. So I just think it's always really hard to do that in the moment, but I just want to provide more positive reinforcement and validation that it will be okay.
Yeah, I think another thing that I've learned kind of throughout my time as a competitive runner in high school and college, like one thing my high school coach like always used to tell me was like an injury or an illness, a lot of times like he called it an enforced rest. So
Mhm.
like it's kind of your body's way of saying like, hey, like you're overtraining or you're doing too much, and like a lot of times people will have their best performances after a period of illness. So
Mhm.
I think just remembering like that, your body knows what it's doing. So
Mhm.
it's really frustrating, and especially when you put in all those hours and you feel like you're losing fitness, but exactly like you said, like you're not losing as much fitness as you think, one, and two, you might actually have needed the period of rest and you're actually going to perform better because of it.
Yep, absolutely. I had a client experience this too, training for Boston. She got sick and she didn't take the time off because she didn't tell me she got sick until after. So I didn't adjust her training plan. And then after, when she still wasn't feeling better, I adjusted her training plan. She took some time off. It was off, she didn't like to, she didn't want to, and she ran a massive PR at Boston. So again, more positive reinforcement that it will be okay. And there's a lot of validity to that. It's your body kind of saying, okay, pump the brakes. We're going to take some rest. And I really do like to look at that as an opportunity for sure. So the other thing I wanted to address to kind of wrap this up, because it's a question I've gotten, is everything that you said, thinking about symptoms, and where they're at and whether or not it's a good idea to run, and especially approaching like returning to training. When people take things like over the counter medications to help them be less congested, to help with sinus pressure, to help with maybe a fever, sore throat, cough, like those types of medications, um, what are your thoughts? Like, are you looking for them to be symptom free and without the medications? Like, how does taking those medications work? Because I think there is a misnomer that this makes my symptoms better and therefore I am getting better, but that's not always the case, to my understanding.
Yeah, I think that's a really important point. So, something like a decongestant or like Dayquil, those things are great and they do help you, get through the workday or whatever, but there are more masking your symptoms than treating them. Um, and I think it is important to kind of not be relying on those to get you through training. So ideally, someone's going to be able to, do a full work day before they even, try to go back to exercise. And
Right.
that is, again, ideally unmedicated, but I know that's not always realistic. So I think taking those medications is okay, but if you're kind of taking them for, like, let's say more than a week, that's kind of where, you're probably masking your symptoms too much. I think another really important thing, I don't know if you've seen the recent, like, is it the Advil campaign? Yeah.
Yes.
Okay.
Yes. I was
So,
gonna ask about this next. Go
yeah.
for it.
So, I know a lot of people use, NSAIDs. So NSAID stands for non-steroidal anti-inflammatory. Those, you know, let's say pretty much I'm okay with everything in moderation, but in particular, those we're not using those to treat every little ache and pain. We're not taking them around the clock because there are so many side effects.
Yeah.
You know, they decrease blood flow to our kidneys, which, as a runner, you're
You don't want
dehydrated.
that.
You're already putting a ton of stress on your kidneys. Like, you don't need to add one more insult on top of that. They also put us at risk, increased risk for gastric ulcers. So decreasing the amount of stomach acid produced. And if you're sick and not eating a lot, like you're already like, not getting as much protection to your
Mhm.
gastric lining. So yeah, that's something I would be extremely careful about. The safest pain medication is Tylenol. The difference is Tylenol does not act on the inflammatory response like an NSAID does, but it also doesn't have all of those harmful side effects. So I advise people to be extremely careful when using NSAIDs concurrently with any type of, honestly, any type of athletic activity, but particularly distance running.
Yeah, and the campaigns too, I'm sure people saw them. I've definitely ranted about this on multiple platforms. I mean, it was like popping an Advil between like laps on the track, and that's like not how we should be using them at all. And like you said, if it's for every ache and pain, one, why are we having so many aches and pains that we have to take Advil? That should be the question. Two, taking the Advil is not helping, it's just masking the pain. So, it's basically allowing you to go do the damage without realizing it until it's too late, and it can have systemic effects on the body. So I appreciate you sharing that. And two, with the asterisk of some of these, like, even cold and flu medications are, like, combined medications, and they may have, ibuprofen, which is what Advil is, in them in addition to other things. So, really being cautious on if you're really, like, relying to, like, get through the day by taking those things, then it's probably not the time to, like, return to activity yet.
Right, I agree with all of that. And I would say if you're taking Advil more than a couple times a week, like for some sort of injury as a runner, like that, you need to go see a sports medicine provider and one, get a diagnosis, but two, like sometimes there is a role for an anti-inflammatory, but in a short prescribed course. So a lot of times, like we'll use something like meloxicam, which is easier on the stomach because of the type of NSAID that it is, and we'll prescribe like a 1 to 2 week course of it, and it does actually help decrease the inflammation and promote healing response. So there is a place for these, but like you need people assume that because it's over the counter that it's safe, but that's not the case, and you really should have a medical provider directing how you're using these medications.
Yeah, no, I appreciate that. It needs to be with, like, some sort of guidance. It can't just be influencer guidance. I'm also curious too because I've gotten this question a lot, especially after the Advil campaign came out while we're on the subject, and I'd be curious as to your opinion on this. Um, People asking about, well, what if I have to take it during my period? Is it okay to keep exercising and take Advil the whole week, maybe of my period because the cramps are so bad? My answer is typically if the cramps are that bad, I also am curious as to why, and you should probably talk to someone, but I'm curious about your response too on like the potential harm of that because it is still a week out of the month, consistently.
Yeah, I think I mean like menstrual cramping is pretty normal for like the first day or two of the menstrual cycle, but I think if it's lasting your entire cycle, I would recommend going to see your PCP or your gynecologist because that just doesn't seem normal, at least that the cramps would be severe enough that you need to take something for them for your whole cycle. And I think another thing that I like um, recommend for I recommend this for everyone, but for female athletes, like taking a down week in training like during the week of your menstrual cycle, especially if you have a lot of like cramping and other symptoms, can be a really good idea. So like in that way, like it's always every like third week of the month, like I take my lighter week where like maybe I take like an extra rest day or an extra cross training day. And I think it can just be a really good way to like get that deload, let your immune system recover, deal with some of those symptoms without pushing through and like trying to like medicate them.
Yeah. Yeah, that's a great advice. I think taking a down week in your training cycle anyway is important, and I usually recommend it like, yeah, every 3rd or 4th week, which lines up perfectly for menstrual cycles if they're regular. Yeah, no, I I think that's great advice. I think just the last thing I wanted to touch on is just specifically like returning to activity and how to navigate that. You talked about, kind of where you want to be in your symptoms, maybe not masking them with tons of medication being a prerequisite. Do you think it's a good idea for people to kind of just jump right back into where they left off? I know you talked about definitely not trying to make up for training and cram extra sessions in. Is there any type of like more objective, strategic way to start returning to exercise? And if it's been like a long time that you had to take off, like kind of extra caveats for that recommendation.
Yeah, that's a really good question. I think like you were saying, it kind of depends on like the extent of what your illness was exactly. Was it GI? Was it more upper respiratory? And then also like what your fitness was like prior to that.
Mhm.
But I think for everyone, I would kind of say like see how you tolerate a walk. Like see how you tolerate a 30-minute walk. And it's like, is that making you exhausted? Like, do you feel like your breathing's normal? Like, because if you're not tolerating a walk, I think that, that's a sign that it's not time to even think about returning to running yet.
Mhm.
From there, I think I would maybe start with like half of your norm. Like if you normally do like a 40-minute easy run, like kind of whatever your shortest easy run is, I would say like cut that in half. And my preference would be that you start with the cross training and see how you tolerate that. But if you want, you could try to run for, 10, 20 minutes and see. And then if you tolerate that and feel good, I would say the next day you can do the same thing and then cross train for like the remainder of the time. So if you're doing like 10 to 20 minutes of running and then 20 minutes on the bike, you
Mhm.
tolerate that okay. Um, I wouldn't go right back up to a full 40 minutes of running. I'd maybe add like 5 to 10 minutes a day and see. And that's, all saying that, this is going by all those principles we talked about, that you're only having mild symptoms during the activity, you're not paying for it, your symptoms aren't getting worse, and you aren't super fatigued afterwards in the 24-hour period afterwards. um, and yeah, basically you're not like that, you're able to tolerate everything um, without your symptoms worsening.
Yeah. No, that's great advice. And I think too, to just tack on to that, kind of the preventative aspect of this is to be smart about your training plan on a yearly basis. There's a lot of attention being given, I think, to things like running all of the marathon world majors right now and like even doing it all in a year, or doing multiple ultra events every year, or even multiple marathons per year. I see people, it's very culturally normal within the Spartan community to do like all of the Spartan trifectas every single year. What do you say about these types of trends in terms of how it can affect our immune system and our health on a long-term basis?
Yeah, I think that competing on that regular of a basis without any kind of prolonged like recovery period, I mean, that's going to be detrimental for your immune system, especially like with, like you were saying, world marathon majors, like not only just the competition, but the travel
Mm,
and the time zone changes and everything. Like that's going to put your body in a chronically stressed state. So, I mean, I'm not saying like I totally encourage people to like do those races, but
sure.
like not all in a year, not every year. It's really important to kind of zoom out and just look at your training from a bigger perspective. Because I know as runners, like we all want to have like, longevity in the sport. And so just not always thinking about the next race, but kind of zooming out and thinking about the years ahead and, you know, okay, I need to take like a couple months off, or like at least a couple months where I'm like just focusing on strength training, or, just giving my body a break and
Mhm.
working on some, different types of exercise. I think it's really important. Um, and it's that's huge in injury prevention and illness prevention in general, is to plan those rest cycles into the broader aspect of your training schedule.
Yeah, I appreciate that. I've even seen like if we're doing this year after year after year, it's like we're doing multiple events every year and we're traveling, and you just, one, you can't really properly train for them because you're constantly trying to recover from them. So it's kind of like this double-edged sword of the event itself being an even bigger insult to your body. And I've even seen people like end up, and again, this is very multifactorial, but it can be a trigger for things like, yeah, autoimmune issues and like really scary immune function types of issues that are more chronic in the future and just take a lot more time to like treat and recover from. So I appreciate you touching on that because
Yeah, I
it's trendy right now.
have seen some research on that can increase our risk for autoimmune diseases. And I don't this isn't as well supported, but even potentially cancer as well, being in that chronic inflammatory state. So
Mhm.
Yeah, it's really important to think about, the bigger picture of your health. And um, like what I always talk about is like in terms of preventing illness, like the key is like to modify your stress. And in order to modify your stress, you can either modify life or modify your training, because
Yeah.
body doesn't really differentiate between types of stress. So physical, emotional, you know, mental stress, like mental stress with school or work, emotional stress fighting with a partner or grieving the loss of a loved one, those are all stressors on your body. And really, we need to like account for those in addition to the physical stress from our training. So if you're dealing with, any of those kinds of things, um, you should really think about modifying your training plan, because otherwise it is going to lead to injury or illness.
Yeah, I really appreciate you bringing that to front. And again, like there is research to support this topic, and it does happen. And again, we're not also necessarily saying just like you have to stop exercising forever. We're saying intense training schedules, which a lot of you probably listening do, maybe even do to the point where yeah, we're doing a lot every single year because this is very normalized and glamorized right now on social media. Um, yeah, it's really intense. So even if it's okay, I'm going to really cut my volume in half and not do these bigger races, for a bit, or I'm going to focus on different forms of exercise that are less intense. I think runners are very like all or nothing. So types of thinker. So I just wanted to specify that a little bit too. And yeah, work with a coach if you're having trouble like holding yourself to that type of thing. Cause I do also see a lot of coaches just being like, okay, yeah, we'll just keep doing this when they know really it's probably not the best thing for their athlete. And we want to support your goals, but if we're kind of constantly, you know, kind of trying to sound the alarm that this probably isn't a good idea, it's because we care about you. So just like your physicians and your other people in your care team. Well, thank you. This was so informative. I want to make sure people know where to find you if they have extra follow-up questions. And then I want to ask you the end of the podcast question. So where can people find you and get in touch?
Yeah, so you guys are free to email me with any questions that you might have. My email's Abigail dot Bideaux, Bideaux at gmail.com. And then I also have an Instagram, which is Abigail Bideaux underscore MD.
Awesome. Yeah, and I'll put that in the show notes so people can go check you out. And yay, end of the podcast question. So I'm super curious on your answer to this. So you are just to set the scene, you are finishing like the best race of your life. It went amazing. You did not get sick in the build up. You're not going to get sick after. That's all going great. What song would be playing at the finish line to embody how you're feeling in that moment?
Oh my gosh, that's a really fun question. Um, so my answer has to do with my husband and my husband's a big marathon runner. And so our pre-race pump up song is AC/DC Thunderstruck. And
Yes.
we actually like walked out to that at our wedding a few weeks ago.
Yes.
So yeah, that's an easy one for me.
I'm obsessed. I heard that at least 3 times during the Boston Marathon, so that's a great one. Anything AC/DC. No one said that before, and that's, like my answer is, like, For Those About to Rock by AC/DC, so I appreciate an AC/DC answer to this question.
I love
Finally, it
it.
only took 5 years. Um, well, thank you so much for coming on the show. I really hope people found this one informative. And we say everything we say with love. We want you to return to exercise, but we also want you to be healthy. Thank you so much.
Yeah, and I just want to take a minute to thank you for everything you do too, because as physicians, we have such limited time slots with our athletes. And honestly, we don't get a lot of nutrition education in medical school. So a lot of the research I do is on my own and using good resources like yours. So I'm just thankful that, you're providing this resource to runners, and it's really invaluable.
Well, thank you. I appreciate that so much. And I appreciate that one, you said that about the nutrition education in med school, but then also that you seek it out in addition to, I mean, everything else you have to do to be in med school. So I really appreciate that. Thank you. And yeah, if I can help you in any way, I'm always glad to. I love collaborating with other practitioners because like you said, it's really hard to just do everything for a patient, because there's such limited time and resources, and I find that with at least my type of practice model, I can actually, like, work with people with more time just because I have more time versus, yeah, sometimes when you're trying to see, like, 20 people a day, it's just really hard to spend, like, an hour with them talking about everything on their diet history, so I really appreciate that.